Hey everyone, welcome back to my channel Medicosguide. This is Dr. Ida Khan and today we'll be discussing about management of breast cancer. Breast cancer is when breast cells mutate and become cancerous cells that multiply and form tumors. Breast cancer is a complex condition that affects millions of people worldwide. While it is a leading cause of cancer-related deaths among women, advances in early detection, diagnosis, and treatment have significantly improved survival rates and quality of life. According to World Health Organization, age-standardized breast cancer mortality in high-income countries dropped by 40% between 1980s and 2020. Countries that have succeeded in reducing breast cancer mortality have been able to achieve an annual breast cancer mortality reduction of 2 to 4% per year. If you want to know the anatomy of breast, link to that video is provided in the description box below. So, in today's video, we'll explore the management of breast cancer, focusing on the 6 key treatment approaches, which are hormone therapy, chemotherapy, surgery, radiotherapy, biological therapy, and physiotherapy. Each of these plays a unique role in treatment, improving survival rates and quality of life for patients. Surgery remains one of the primary treatments for breast cancer. The type of surgery depends on cancer size, location, and spread. We have 3 surgical options. The first one is breast conserving surgery. Here, in this surgical procedure, there is only the diseased portion of the quadrant of the breast which is removed. Second one is mastectomy. Here in this procedure, the entire diseased breast is removed. And lastly, reconstructive surgery. Surgeries can be done in which breast is reconstructed after being removed entirely. Now let's discuss them one by one. So the first one is breast conserving surgery. Here we have 2 types, lumpectomy and quadrantectomy. In lumpectomy, only the tumor and the rim is removed, while in quadrantectomy, as quadrant refers to the 1/4 of the breast, so here the 1/4 of the diseased quadrant is removed. And this procedure is also referred to as partial or segmental mastectomy. Now, the second surgical option is mastectomy. Here it has 3 types. Simple mastectomy, modified radical mastectomy, and radical mastectomy. Let's discuss each of them. So the first one is simple mastectomy. This is also referred to as total mastectomy, and here there is removal of the breast without nodal dissection. Now next is modified radical mastectomy. Here there is removal of breast with axillary lymph nodes. And the last one is radical mastectomy. Now here, there is removal of breast, axillary lymph nodes along with the chest muscles, which are pectoralis major and minor muscles. And these breast conserving surgeries are treatment of choice for women with relatively small breast cancers. Now let's talk about reconstructive surgeries. The surgical approach has 3 types, implant reconstruction, latissimus dorsi flap, and transverse rectus abdominis flap. Let's discuss them one by one. Now the first one is implant reconstruction. This is a surgical procedure where a silicone or saline filled implant is used to recreate a breast after mastectomy. Now latissimus dorsi flap reconstruction. Here a flap is taken from a latissimus dorsi muscle and it is used to reconstruct the breast after mastectomy. And now the last one is transverse rectus abdominis myocutaneous flap or tram flap. Now here these tissues are taken from the lower abdomen and are transported into the chest in order to reconstruct breast after mastectomy. And now comes the physiotherapy management of breast cancer. Physiotherapy plays a crucial role in post-treatment recovery for breast cancer patients. It helps restore physical function, reduce pain, and improve quality of life. Most patients recover quickly after breast cancer surgery and have no lingering problems. When problems do occur, they include difficulty moving the arm due to pain or tightness, mild weakness, which may be due to discomfort, and swelling of the arm. So, early physical therapy that is started soon after surgery can help these problems go away quickly. Now, assessment. Assessment are of 2 types, initial assessment and specific assessment. Initial assessment is done to evaluate the patient's overall physical function, range of motion, strength, and mobility. While in the specific assessments, these are done to assess for lymphedema, shoulder mobility, and scar tissue mobility. Physical therapy treatments for breast cancer include gentle stretching, massage to improve healing and range of motion, joint movement, teaching good posture, strengthening, nerve gliding, and home exercises. Now let's talk about phases of physiotherapy in breast cancer surgery. So now the first phase is pre-surgery phase. Here, educate the patient on postoperative exercises, breathing techniques, and mobility. Teach exercises to maintain shoulder mobility and range of motion, and teach deep breathing exercises to improve lung function. Now the next phase is post-surgery phase. And in here we have acute phase. So firstly, we manage pain. And here you use modalities such as heat, cold, or electrical stimulation to manage pain. Then progress exercises to improve shoulder mobility and range of motion. Continue deep breathing exercises to improve lung function and encourage early mobility to prevent complications. Next comes the subacute phase. And here we have scar tissue mobilization, in which we use techniques such as massage or manual therapy to mobilize scar tissue. Then introduce strengthening exercises for the shoulder and upper limb. Educate on lymphedema prevention techniques such as exercises, compression garments, and skin care. Progress exercises to functional activities such as reaching, lifting, and carrying. And now the last stage is chronic phase. Here, continue exercises to maintain shoulder mobility and range of motion. Progress is strengthening exercises to maintain strength and function. Continue lymphedema prevention techniques and manage any lymphedema symptoms. And gradually return to pre-surgery activities including work, sports, and hobbies. Since lymphedema is a major complaint, let's discuss it in a bit more detail. First of all, lymphedema is a swelling in the arm or chest area due to lymph node removal. So here we can include the treatments to drain the fluid from the area. We can use short stretch compression bandaging, an exercise program, and a skin care in which the patients are asked to avoid any trauma or injury to reduce the chances of infection. Long-term self-help with lymphedema can also be encouraged, in which the patients are asked to use compression clothes, do self-bandaging, and get additional education. Now, prevention of lymphedema. It includes skin care, activity and lifestyle, avoid restricting the arm or legs, using compression clothes, and avoiding the extremes of temperature. Now comes our next treatment option, that is radiotherapy. Radiotherapy uses high energy rays to target and destroy remaining cancer cells after surgery. It's especially effective in preventing local recurrence of cancer. It has two types, external beam radiation therapy and brachytherapy, which is internal radiation. Treatment duration is usually 3 to 5 sessions a week for several weeks, and the side effects can include skin irritation, fatigue, and localized swelling. Now, indications of radiotherapy. Radiotherapy is indicated for large tumors greater than 5 cm after breast conserving surgery, if there is lymph node involvement, or in the patients who are aged less than 35 years. To avoid making long videos, I'm ending this lecture here. There is much more to be discussed in the next part of this video, such as other treatment options, staging of tumors in detail, so stay tuned. It's important to understand that managing breast cancer is a multidisciplinary process that requires a combination of medical treatments and supportive care. Early detection and timely treatments are key to improving outcomes. And subscribe for more videos on health and wellness, and share this video to raise awareness about breast cancer management. Thanks for watching.